Today is April 12th, 2026, and a stark reality confronts us across Africa. Millions of people live without access to even the most basic healthcare services. This is not a problem of obscure tropical diseases alone, but of everyday health needs, a safe birth, a reliable diagnosis, or the consistent management of chronic conditions like diabetes. The gap is a chasm separating families from the care they need to survive and thrive. In Nigeria, Africa's most populous nation, this gap is particularly pronounced. With over 200 million people, its healthcare infrastructure is stretched thin, leaving a vast underserved population. This deficit is a profound human crisis, but it also represents one of the most compelling investment theses of our time. The scale of the need is staggering. For every 1,000 people in Nigeria, there are fewer than half a doctor and just 2 hospital beds. Compare this to developed nations, and the disparity becomes almost incomprehensible. Existing facilities often struggle with outdated or non-functional equipment. A hospital might have a surgeon, but no reliable anesthetic machine. A clinic might have a nurse. The first and most scalable investment opportunity lies in primary care clinics and outpatient centers. Think of these not as massive, complex hospitals, but as the neighborhood frontline of healthcare. These facilities are relatively inexpensive to establish and can be standardized for rapid rollout across urban and suburban areas. They address the most common health needs, treating malaria and typhoid, managing hypertension, providing prenatal checkups, offering vaccinations. The demand is constant and predictable. A single well-run clinic can serve thousands of families, becoming an essential community asset. The revenue model is straightforward. Fee-for-service payments, corporate retainers for employee care, growing integration with private health insurance schemes. A network of such clinics can achieve economies of scale in procurement and management, reaching profitability in as little as 1 to 2 years. A second, highly synergistic investment is the establishment of modern diagnostic centers and laboratories. Accurate diagnosis is the bedrock of effective medicine, yet quality labs and imaging services are remarkably scarce. Many clinicians are forced to treat based on symptoms alone, leading to poor outcomes. An investor can build a standalone diagnostic hub equipped with essential tools like investing in an emerging market like Nigeria naturally comes with a set of distinct risks, but each can be managed with foresight and strategic planning. Primary risk is often regulatory and bureaucratic. Securing permits, licenses, accreditations can be a slow and opaque process. Delays and shifting requirements can stall a project indefinitely. The most effective mitigation is to build strong local partnerships from day one. Engage experienced local legal counsel. Engage consultants who know the Ministry of Health and state agencies. Proactively build relationships and maintain transparent communication. A second major operational risk is unreliable core infrastructure. Power supply chains. A state-of-the-art diagnostic machine is useless if the electricity is off for 8 hours a day, and supplies stuck in customs can stop a clinic from functioning. To counter this, build resilience into your business model. Section 4. The ecosystem of success. Workforce, regulation, financing. A successful investment does not exist in a vacuum. It thrives within a supportive ecosystem. Understanding the realities of the local workforce and regulatory environment is crucial. Nigeria possesses a large, educated, and ambitious population. There's a shortage of highly specialized medical professionals due to brain drain. Nurses, community health workers, administrative staff. The key is to invest in their continuous training and professional development. By establishing a reputation as an employer that offers growth opportunities and a positive work environment, a healthcare enterprise can become a magnet for top local talent. Partnering with professional associations, partnering with medical universities. These partnerships strengthen the pipeline and ensure a sustainable supply of skilled personnel. The regulatory landscape, while sometimes challenging, is also showing positive momentum. Section 5. The call to action, seizing the 2026 healthcare dividend. The case is clear. The chasm between healthcare need and healthcare availability in Nigeria is immense, and the conditions are ripe for investment. Demographic tailwinds, a growing consumer class seeking quality care, a government increasingly open to private sector solutions. These factors have aligned to create a powerful opportunity. This is not a speculative bet on a distant future. It is a response to a present and urgent demand. The time for deliberation is over. For investors with the vision and the pragmatism to execute a sound strategy, the moment to act is now. The financial returns are compelling, but the social dividend is immeasurable. Lives saved.